More than 30 million people are diabetic, and the costs for caring for diabetes have skyrocketed, as much as the number of cases have. 8 on Your Side's Rod Carter joins us live to tell us more about how people are paying for that very expensive care.
You know, when you hear the numbers, it really is kind of jarring. And we just got some new numbers in from the American Diabetes Association about this, Jen, and they now estimate that the total costs of diabetes have gone up to $327 billion in 2017. That's up from $245 billion in 2012.
Okay, very good.
2 weeks ago, Lori Claybeck got news she did not really expect. She found out she was type 2 diabetic.
Well, it was very emotional because there's something wrong and it's something that you're going to have to live with for the rest of your life.
Since then, she's been on a quest to learn more about what she needs to do to take care of herself. First, coming here to Your Best You, a personalized primary and diabetes specialty care center off Florida Avenue.
So it's a little scary, and then you get this list of all kinds of medication that you're going to have to be on, and testing and products that you have to use to do the testing. It's not even medication, it's needles and it's test strips and it's monitor.
Healthcare costs for diabetics is 2.3 times higher than those without. Lori's doctor, Dr. Sinead Davis, sees the problem firsthand.
How do people manage that? I mean,
Well, it's hard. It's very, very difficult. There are out-of-pocket costs.
Now, to give you an idea of just how expensive diabetic medication can be, let's just take a look at insulin alone. The cost of insulin has more than tripled over the last few years.
From $231 to $736 per year per patient between 2002 and 2013.
It's a huge problem. When I usually talk about diabetes, I say it's big, it's costly, and it's serious.
At Tampa General Hospital's Diabetes Self-Management Office, Renee Meehan and Sharon Elazar deal with this problem firsthand.
So what's happening is that our hospital is very busy, full of patients that have stopped their meds. We get people here all the time with blood sugars extremely high. They know what they need to do, they just can't afford their medication.
For some people, life presents a very difficult choice: food or medicine.
They'll either take their insulin every other day, they'll take it for a month and run out, and then they have to come to the hospital. They'll borrow.
But there is hope and programs to help. Even drug companies provide some medications cheaply. The American Diabetes Association recommends asking your doctor to prescribe a higher dose of pills, for example, 500 milligrams instead of 250, and use a pill splitter to get the correct dose. Consult a pharmacist, though, because some extended-release medications are not suitable for splitting. For people without health insurance, many manufacturers provide free or discounted medications through patient assistance programs, or the Partnership for Prescription Assistance can actually offer some help to people who qualify.
How do people do this? How can they afford it if they have some kind of lifelong problem that they have to take medication for?
So we have talked about the financial cost. The human cost is big, too. People with diabetes are at greater risk for stroke, blindness, kidney disease, heart disease, and loss of feet, toes, or even, of course, legs. And for people with type 2 diabetes, we cannot ignore weight management. That plays a huge role in the care. One thing that you can do for free is exercise.
Yeah.
Get out and walk.
Yeah, no doubt. Now, you mentioned that there are some places where you can get the prescriptions a little bit cheaper.
Yeah, you know, there are a lot of companies out there, like Publix offers some cheap prescriptions. Walgreens will do that as well. Just check around before you actually get your prescriptions, and you can find some of those great places. Again, ask your physician. They can certainly help you. And look up groups at the hospital like TGH. They have a great program, and a lot of the hospitals around here have great resources that you can talk to with folks.
And there are also manufacturer coupons sometimes that you don't even know exist. So you kind of have to ask your pharmacist, ask your doctor, look online.
Drug companies sometimes give out to people who are less advantaged.
That's right. All right. Thank you, Rod, very much. Appreciate it. There's more to see and to share on WFLA.com and our social media pages, including the full interviews with the diabetes doctors and healthcare providers in Rod's story.